Thank you for tuning in to the Children's Heart Foundation's At the Heart of Research chat. I'm Jessica Cowan, the Manager of Research and Advocacy at the Children's Heart Foundation. Today, I'm excited to be speaking with Dr. Audrey Dionne from Boston Children's Hospital. Dr. Dionne was recently funded by the Children's Heart Foundation and American Heart Association's joint funding process for her research on predicting arrhythmogenic risk in post-operative congenital heart disease patients. So thank you so much for being with me here today, Dr. Dionne.
Thank you for having me.
Yeah. So you recently were funded through the Children's Heart Foundation and American Heart Association's Congenital Heart Defect Research Awards for your research project, predicting arrhythmogenic risk in post-operative congenital heart disease patients. Can you tell me a little bit about your expertise and your background and what area of research that this grant will be focusing on?
Yeah, so I'm a pediatric cardiologist who specializes in electrophysiology, which is the management of arrhythmia or abnormal heart rhythm. My research has focused more specifically on the management of those abnormal rhythm after cardiac surgery in children. The aim of this grant is to refine our prediction of which children will develop arrhythmia after cardiac surgery and to see if simple bedside testing with standardized treatment protocol can improve the outcome of children that are at high risk of arrhythmia.
Can you explain a little bit of your process and how you are going about conducting your research?
So there's two phases to our research. So the first thing that we're going to do is we created this risk score to try to define who's at low risk or high risk of arrhythmia. So we're going to prospectively validate this risk score over 1 year. Following that period, we're going to focus on the highest risk, and we're going to see by further stratifying those patients with simple bedside testing and preemptively treating those that we consider at higher risk, we can improve the outcome of those children.
So the first year, and so you have 2 years of for this project. What would be the second year? Like, how do you build on 1 year to the next year?
Yeah, so I think the first year is critical for us to refine the risk prediction model and this risk prediction score so that we get better at really identifying the highest risk group of children for arrhythmia. And then we want to kind of devote more effort into this highest risk population because those are the ones at risk of arrhythmia and at the same time prolonged hospital length of stay and worse outcome.
Does it have any impact on the severity of like the surgery that the patient will be going through? So the more severe the defect, I guess I could say, versus a less severe, does that have an impact on whether or not you'll see that arrhythmogenic risk?
So we'll include every patient who undergo cardiac surgery in our project. But from the information that we've been able to gather over the past few years, we know that younger children and those who have longer surgery tend to be more at risk of those abnormal rhythms after the surgery.
Okay, that makes sense. Thank you for clarifying. So why is this research important? Well, you kind of explained why this research is important. But how will it change the care and treatment of the children and adults, young adults, with congenital heart defects?
Yeah, so the tachyarrhythmias, or those abnormal fast heart rhythm after surgery, are relatively frequent. And they can be due to several reasons, which include abnormal conduction pathway or irritable area of the heart that stimulate those abnormal impulses. But regardless of the cause, those arrhythmias are acutely destabilizing and require rescue treatment and sometimes longer time in the intensive care unit. We also know that children with arrhythmia after surgery, like I said, need to stay longer in the ICU than those without and also have a higher risk of dying. With this project, we aim to predict which patient will develop arrhythmia and try to treat them before they occur. And we hope that by preventing those arrhythmias after surgery, will accelerate children's recovery and improve their survival.
So how did you, what was the idea behind actually wanting to go with this research project? Did you just have a moment of like, I think this is something that should be studied, or were you like looking at arrhythmia previously to how you decided to go about this study?
Yeah, so as a cardiologist and an electrophysiologist, a lot of my day-to-day job involved managing those patients after cardiac surgery, especially those who develop arrhythmia, and treating them with medication. And I think the more I interacted with those children, I realized how big of a problem those abnormal rhythm could be, and also how sure we're able to treat them, but no one has really focused on, well, could we do anything to prevent them? So I think it's mostly from interacting with those children every day that the idea came up.
Okay, great. And so with that, why did you decide to submit your research project to the Children's Heart Foundation and the American Heart Association's joint research funding process?
So congenital heart disease is a significant problem in children and young adults, but it often doesn't get much attention from other funding agencies when competing with adult cardiovascular disease, which affects a much greater number of patients. And then the Children's Heart Foundation and the American Heart Association, by creating this joint funding process, ensures that research focusing on children with congenital heart disease will be prioritized and funded. As their mission was very similar to ours, it created the perfect partnership for this.
Perfect. And like you were touching on the mission of the Children's Heart Foundation, why do you think that mission is so important? I know you said it focuses on the pediatric congenital heart disease patients, and all we do is fund research. So to you as a cardiologist, I can see where it would be important for your patients, but maybe a little personally, why is it important to you?
Yeah, and I think the Children's Heart Foundation has been really good about funding research projects for patients with congenital heart disease. They it's a priority to fund research that would benefit those patients. And I think those research projects and scientific collaboration advance their knowledge of the disease, lead to discovery and testing of new treatment, and hopefully improve the quality of life and survival of children with congenital heart disease. And then more personally, like this research would only be possible with the support of the Children's Heart Foundation, and is essential to ensure that our patients with congenital heart disease have the best chance at a normal life.
Yeah. Well, then it's, that's absolutely what we want. We want to see these, your research have an impact. And I see, you can already tell that it will have an impact because of the research you're doing and what you see in your patients day to day. And how will this type of continued research help congenital heart defect patients live longer and healthier lives? Let's say even if they experience this risk and are at higher risk after surgery, how will that impact their future?
I mean, specific to the arrhythmia problem, if you have this problem after surgery, they often have to stay longer in the hospital. And the longer you stay in the hospital, you're also at increased risk of other complications. It's also very disturbing for families that are not always from Boston, sometimes come from other states and have to kind of put their entire life on hold to take care of their children. So I think anything we can do to kind of accelerate their recovery and make sure we kind of get them back to normal life, I think may be beneficial for them.
Yeah, and absolutely. It has a huge impact on the families as well. And, it's hard when you have to watch, your loved one go through the surgery or the diagnosis and then the surgery and then the, ICU stays, the longer stays. So
a lot of these parents are kind of expecting the congenital heart disease. They talk a lot about the surgery, and usually when you kind of bring out an arrhythmia down the line, this is kind of something more that wasn't anticipated or wasn't part of their planning either. Mm-hmm. So these can be very disturbing and distressing for families.
But that's why we fund research like yours, so we can help curb that, or find ways of preventing or supporting after surgery. So
yeah, and that's really with the support of the Children's Heart Foundation that we're able to continue this work and continue fighting for new discoveries and new treatment to make their life better.
Yeah, and this project sounds like it's going to do just that. And with that, I'm going to say thank you so much for joining us on the Zoom chat today, and taking the time to talk a little bit more about your research. So I really appreciate it, Dr. Dionne. Thank you.
Thank you for having me.
And I just wanted to say thank you to everyone for listening today, and we'll see you next time for the Children's Heart Foundation's At the Heart of Research chat. Thank you.